Social emotional wellness deals with being able to interact with your environment, and with children, that typically means interacting with their parents or their caregivers in a very positive way. It's a complex beginning because we know that children start off as fairly clean slates, and then as they move forward, it becomes more complicated and more complex.
And what factors go into developing a healthy social emotional wellness?
The big factors are attachment and relationships. And we know from lots of research, this was done even back in the 60s, that children without healthy attachments and without good relationships tend to develop problems not only when they're young, but also that relate to when they're older as well.
So are there any things that parents can do that might not just necessarily be a natural thing that parents might do to help their children?
The big things that are important for children are talking to them. That's a huge deal. Reading to them, having meals with them, interacting with them in a positive way, as well as when you do have to do discipline. Discipline means to teach, and we often forget that because people think about discipline as something that you do to stop behavior, but really what we should be doing is teaching behavior. And if parents remember that, that's a really positive way to look at what you have to do to teach kids right from wrong and ways to behave and not to behave.
So are there certain ways that you advocate in particular doing that?
For discipline, the big thing to remember is to not be angry when you discipline, and that it sounds, again, very simple, but it's not, because usually the child has behaved in a way that makes you angry. So taking yourself out of that state before you can think about what you're going to do with your child, and that old adage of counting to 10 is really, really important, because if you take yourself out of the angry state, you're much more likely to be in a positive frame of mind to teach your child the difference between what their behavior was and what it should be.
It sounds so simple and yet a bit difficult when you're in the midst of it.
Absolutely. Absolutely. It does sound simple, but it does take practice. And that's the thing that we don't always think about, because why should you practice parenting? But it is true that you have to practice it. It's not something that comes innately to everyone the first time they do it. So having supports, having your provider or parents as teachers or your early childhood providers helping you with some of the things that they use that are positive are ways to reach out and find help as well.
So talk a little bit about nature versus nurture. That's something we all have been hearing about most of our lives. Talk a little bit about that and how that plays into social emotional wellness.
We do know that it's not one or the other. It's a combination of both, that children need both the nurture that the parents and other caregivers provide, and they also have an innate nature, and some people would call it temperament, that helps form their characters and the way that they behave as well. So the reality is we have to figure out how they interact and the best ways to use the strengths of that child to move them forward in their environments, rather than criticizing or finding things wrong with the child's temperament. Working with that child's temperament and understanding it is even more important to the nurture part of the nature.
And I'm guessing if the child's temperament and the parent's temperament are at odds, that's a whole new set of issues.
It has to do with expectations, and the truth is most parents expect that Gerber baby when the baby's born, and when it's not a Gerber baby, it somehow is a reflection on you. Either you did something wrong or there's something wrong with the child, and it's really not that at all. It is hard when the child's temperament doesn't match your own, and understanding that they don't match is the first step. So having someone recognize temperament is really important. And I can tell you, sometimes you can even tell in the nursery how a child's temperament's going to be. You take the child out to the mother and they're content and, laying there and everybody's holding them, or a child who's moving around and very motion oriented. They're very different temperaments most likely, and you can identify some of those traits. And if you point those out to the parent, this child really likes to move, they're going to need a lot of stimulation to keep them happy and content versus the child who is content no matter what. Because sleeping like a baby is a misnomer. Nobody should sleep like a baby. They don't sleep well. They wake up every 2 to 3 hours, right? Those kind of expectations parents have of their children are really not in congruence with what we really see sometimes.
You talked a little bit today about sleep and what an issue that is, not only for very, very young children, but children of all ages. And is that a symptom of our society as a whole, that adults aren't sleeping necessarily as much as we should either? But can you talk a little bit about sleep and the importance that it has?
I think a lot of our health problems relate to sleep. And we see that more and more, not only in adults, but in kids too. And we are so wired, for want of a better term, with technology these days, that to get away from technology is almost harder than accessing it for many folks. So, and TVs are a big part of that. They're not only are they entertainment, they are babysitters, they're caregivers sometimes, and we need to get out of that mode, not only for our kids, but for ourselves, because we know that if kids are in front of a television or have access to a television, especially in their bedrooms, they don't sleep well, and that's been shown over and over again. And then it goes on into their early childhood years, their school years, as well as their teenage years, and probably into adulthood. Not only does it affect their behavior, but it affects their health. We know that it's hooked up with obesity and other problems, that health problems that we want to stop. So if we can really look at sleep and how important it is, and especially an uninterrupted sleep for kids once they're to the age that they sleep through the night, I think we will see a decrease in problem behaviors, especially in school.
And one last thing, are there red flags that parents should be aware of, that their child might not be developing in a quote-unquote normal way on the social emotional scale, and what steps should they take next?
I think that parents should always have concerns about how their child is developing, but realistically, there are some things they really need to look for. And the first one is a social smile, as we call it. When a child smiles at you, there's nothing more powerful than that. And most kids will have a social smile by 4 months of age. So we should be concerned if they don't have at that age. The second thing is language acquisition. It's so important for kids to be able to relate to their environment. So babbling by 9 months of age, listening to you when you speak, or attending to your voice by 9 months of age is an important milestone as well. And the last thing is something we call joint attention, or if you're pointing at an object or trying to get your child to notice something, that they do pay attention to that as well. And that usually is between 9 and 12 months of age. Those are things that we expect children to do as they're socially growing in their environment, and if they're not, the parent should bring that to their provider as a concern. And the provider should pay attention to that parent's concern as well.